Well, welcome everybody on this warm and windy late November day. I'm Lynn Hobson, and I serve the university as the Dean of Students. And I just want to thank you for joining us for our last Q&A town hall of this semester. I guess I don't know if it's true for everybody, but I think for most people, it's been a long semester, and we are getting to that winding down stage. So today there's just a few things that we want to cover, and then we're going to transition into the Q&A section of the program. So I would just kind of like to start and talk a little bit about, I think what's on so many people's minds right now is that need for family and friends, because this is the time of year for most of us, for many, many years, we've spent next week with family and friends. And it might be a little bit different this year for folks. I just kind of wanted to talk about that for a minute, primarily through the lens of how to stay safe. And I know safety and everybody's health and well-being has been on the foremost of everybody's minds. And I would just really like to recommend that you spend some time on the CDC website. It's the best resource we have with the most current information about how we can all stay safe and be with our friends and family if that's what we choose to do. And there's two really good pages on their website. One is specifically about Thanksgiving and how to go about engaging in that kind of gathering in the safest way possible, or how to host that kind of gathering. And then there's also one that is more generally about holiday celebrations. And on both of those, there's topics like dealing with holiday stress, how to properly host a gathering, how to properly attend a gathering, and how to travel safely. So I would recommend getting on the CDC website and looking for those pages with that information. I think that tomorrow in the Hornet announcements, we'll have the actual links. So for those folks that don't want to just go out there and look for it, if you'll just get on the Hornet announcements tomorrow, we'll have the links and you can go right to those two pages. And I guess the one thing that we can all say in our sleep, maybe we even dream about it, I don't know, but it says mask, distance, wash your hands. And I'm sure people are tired of hearing that, but COVID's not tired of us. So I think it's really important as we get into a time where once we get with our family and friends, we just become a little bit more relaxed. Just try to remember that masking, keeping our distance, and washing our hands is the best thing we can do for ourselves and for each other. So with that, I'd like to turn it over to Ray.
Thanks, Lynn. Appreciate that. I wanted to cover a couple of items here. One of them is going to be a little bit of information about some resources that we have available to employees here on campus. And then the second thing I do want to do is provide a little bit of an update for faculty and staff on what work plans are going to look like over the semester break. So let's start with some of those support resources that we've got here on campus for our employees. So as we do enter into that holiday season, just a quick reminder that faculty and staff who are enrolled in the State Employee Health Plan have access to the Employee Assistance Program, which is a great resource for us. They provide up to 8 free counseling sessions per situation that pops up. They've got additional resources and supports that they can provide, including things like assisting with creating budgets for holiday spending, help with locating the perfect gift for a loved one, even helping to identify assistance and provide supports around looking at elder care options through the holiday season. Additionally, they can provide ideas for navigating the holiday season and this year in that kind of pandemic style, if you will. A ton of more other resources are available, including a great online resource library. So check your emails. There should be an email out there from HealthQuest at Cerner that contains a lot more information, including how you get a hold of the EAP, and also how it is that you can access those online resources. So the other update I wanted to provide is an update on the work plans for this holiday break as we're coming up to the end of the fall semester. So if you'll remember, our goal was to return students back to campus as safely as we could for the fall, and we accomplished that. So kudos, well done. As we're seeing that increase in cases, and as students are moving for the rest of the semester into that remote instruction, the vice presidents are actually communicating and working with their departments to scale back to more of a remote operation where that's possible. So remember, we're still going to be open for business. So all of those expectations for quality and quantity of work, making sure that we answer the phones, all of those good things, those don't change, especially as we are able to move back into some of those remote operations. I would also remind you that there are going to be some office and some functions where there will need to continue to be an on-campus physical presence. So that is one of the pieces of this as well, because again, we are open for business. And just again, to follow up with what Lynn said, as a reminder for those employees who will be working on campus, remember our expectations for wearing masks, for social distancing, practicing good hand hygiene, and making sure you complete those daily assessments. All of those are still in force, so nothing there changes. So keep an eye out on communication from your department leadership on what exactly that means and what that's going to look like for your department, particularly as we come back after the Thanksgiving holiday here in just another week or so. So I think that's the update that I had. So Kent, I think I'm going to toss this over to you for an update about some of those upcoming sports activities.
Very good, Ray. Thank you. Yeah, for the first time in some 275 days, Hornet Athletics will get a chance to play. Our basketball teams are in Kearney, Nebraska, for tonight, and actually they play the women's basketball plays at 5:30, men play at 7:30. So, like all of us, it has been quite a long journey, and our student athletes are excited to get a chance to resume competition. We have been very careful during this time, and I'd like to go over a little bit of what things will look like at home games. But also, actually, I mentioned tonight's game. You can listen to those games on KVOE, or you can log on to the MIAA network through our website, through esuhornets.com. That is behind a paywall. There's a single game or a single day pass, and then there's a season pass that you can watch every game home and away on your computer via web streaming. So encourage everyone to do that and follow our teams. I know our kids would appreciate it very much. So we have been home games. I wanted to talk a little bit about this. Our first game is December 3rd, and we've been working very closely with Lyon County health officials. Unfortunately, with the recent spike, and we've had plans in front of them, and those plans have changed as more cases have come up here in the last 30 days or so. So the White Auditorium will not be open to the general public. What we're doing is right now just allowing on floor access, basically the teams and the officials and those who have gone through weekly testing are the ones, both our opponents and us, are the only ones that are on the floor. We are contemplating allowing immediate family of players, of our players, to attend via pass list. Lyon County Health has been very helpful wanting to get that done. But it just got to be, we've just got to be so careful. Now it's not, there's plenty of room to spread out in White Auditorium, and we would put the people far apart, and if everybody does what they're supposed to and wear a mask, we should be, we should be okay. with that. So last little thing, trying to have some fun with, I mentioned the MIA network that will be video streamed. And so we'll have cameras there. And one of the things that that our assistant AD, Brett McLaughlin, fan cutouts. If you would like to send us a picture of yourself or your kids or your dog or whatever, and your cat, and have them up there in the stands, chances are they'll be on TV, because we just want to make it as fun of an environment for our players as we can. So I know, Brett, if you're interested in that, Brett McLaughlin is our guy to contact, and I'd like to see. I think he said we already have some 75 or 80 people that have purchased those and cutouts of family and friends and pets and grandma and grandpa and whoever. So so at any rate, that's really all I have. I'm certainly here all the time to answer questions if someone wants to shoot me an email. But other than that, we will. I'll ask Gwen Larson to kind of facilitate the rest of the call here. And again, thanks for everyone's support, and be well over the holidays.
Thank you, Kent. That's great information, and I can't wait to see what kind of cutouts that we get in the arena. So before we start with questions that have already come in, I want to remind all of you that you can still submit questions. If you go to emporia.edu/live, find this event and click submit questions, you'll have a simple form to fill out. Those will come into a spreadsheet in real time, and we'll add those to our list. So right now we're going to jump into questions that we've already received, and they really do boil down to about two categories right now. So first, we're going to talk about COVID testing with Dr. Williams, our Vice President for Student Affairs. So we know that students have already been offered free COVID tests before they leave campus. Our first question, Dr. Williams, is do ESU employees get some free COVID testing, including if they're working remotely?
So the answer at this point is, for this semester, the remainder of the semester, no, but we still are working with faculty and staff. If they do feel symptomatic, they still can schedule an appointment with the health center and see if they meet the criteria that they could do a test based on the symptoms that they're presenting. There are options out there that they can do a test. The lab that we have used, the CRL lab, does have an option where someone can request a test. I think it's $110 if they're interested in doing that in a private setting. We do have details that we're finalizing for a massive testing program upon return in the spring, in which faculty and staff will have a couple of days options to sign up and do a test again. That'll probably be the first week in January sometime for faculty and staff. And as we get closer, we will have some details on that.
Okay, and that actually was our second question. So
hey, look at that.
Apparently you've just passed the test as of now. I don't have any more testing questions for you. I'll let you sit back for a little bit. I'm going to move to President Garrett now. We do have several questions about next spring, but before that, President, we have a question asking about contact tracing. The question is, because contact tracing is conducted by Lyon County, how do we know that our students did not contract COVID from in-class interaction?
That's a great question, Gwen. Thank you to whomever sent that question in. And to be fair, we can't ever know exactly where someone who gets COVID got the COVID. What I can tell you is that so far, there's been no report that has reached my ears of transmission of COVID in a classroom here at ESU. And I'll just remind you all that we're not limiting that to the fall semester. We had some summer classes that were also conducted face-to-face. I also have been told by the other university presidents that they have not received any reports of transmission of COVID in their classrooms either. And So you can't ever know with absolute certainty, but it certainly seems to be the case that individuals who are tested by our health clinic typically have a pretty good sense of where they may have gotten it, and the classroom is not what they're mentioning as the source of the COVID contact. Let me mention one other thing with respect to contact tracing, just so that everyone is aware of this wrinkle with respect to contact tracing. This is becoming an issue across the state of Kansas because of the volume of cases that we are dealing with. But one other thing that you may be interested in knowing, and it might be a disappointment to you even, is that some months ago, the Kansas legislature passed a law that allows everyone to opt out of contact tracing. And so there's a real sense in which healthcare professionals' hands are a bit tied when it comes to doing effective contact tracing, which I know must be very, very frustrating to everyone who's in the healthcare arena right now.
Next question also talks about our monitoring system and the numbers we see on campus. So how does Emporia State use the numbers we see in on-campus monitoring to evaluate the situation?
Also a great question. And let me just real quickly take a moment to remind everyone of the kinds of monitoring that we have been doing on campus. We've had throughout the semester 4 kinds of testing that has occurred with respect to our students. The first was the testing that was offered up to students, faculty, and staff before the semester even began. Throughout the semester, you may have been aware, if you're a student, of the several occasions when you were invited to participate in voluntary surveillance testing as well. And in each instance, we were able to offer surveillance testing to at least a couple of hundred students at a time. We had the capacity to do more, but that's a second kind of testing. The third kind of testing that we have been doing on campus throughout the semester is in our health clinic, and that is symptomatic testing. And that's been open to our students, and more recently we've opened that up to faculty and staff as well. But those individuals make an appointment with the health clinic, and then they go in and they wait for their results. Then the fourth kind of testing that we've been doing throughout the semester has been testing of our athletes. We have done testing on a biweekly basis of our student athletes, and more frequently now as we're seeing some athletes beginning to compete. So we're doing those 4 kinds of testing, and of course we're monitoring the numbers, and I'll remind everyone that we do post every Friday afternoon the numbers that we're seeing on campus. One thing that has been true here at Emporia State, and I think we all owe a huge debt of gratitude to the hard-working staff in our health center and to the good work done by everyone on campus, is that our numbers have been much lower than the numbers of peer institutions for most of the semester. We've seen a bit of a spike coming out of Halloween, and that's obviously been concerning, but our numbers have remained for the most part pretty low compared to most other institutions. And of course, we have had the ability to isolate or quarantine students who have been testing positive. For the most part, students have decided to return home, whether that's back to a local apartment or back to their family members, and do not remain on campus once they have tested positive. So those are just some of the things that we're tracking as we try to get a handle on what our numbers look like on campus. And as I said, they've, for the most part, been quite a bit lower than at our peer institutions throughout the semester. So kudos to everyone here at ESU for the hard work that it took to make that true.
Let's jump into the spring semester now. We have several questions here. I'll stay with you, President Garrett, and then we've got a few for the academic folks. So several questions are asking about what's going to happen for spring. These questions are based on the rising cases, the fact that the pandemic is worsening in Kansas and nationally, as well as a possibility that Governor Kelly will close the state, or that nationally we might see a lockdown. So the question boils down to, what are the plans for the spring semester, and especially changing to remote learning?
Okay, well, there's a lot in that series of questions about the spring semester, and I wish at times that I had a crystal ball, and unfortunately I do not, but here's what I can tell you about a number of things that will be important as we move toward the spring semester. One is, we're still 2 months away from the start of the spring semester. A lot can change during that time, and obviously we'll be watching very closely to see whether as a state we're making progress. Because if the numbers remain what they have been here in recent months or recent days, it would be, I think, very concerning to begin with face-to-face instruction, given what our recent numbers have looked like. But if, as we all hope, we begin to get a bit of a handle on it, then our plan would be to have face-to-face instruction, much like you saw during the fall semester. And if you recall, during the fall semester, we started the semester with most of our classes that were going to be face-to-face, face-to-face. We saw some classes that were hybrid classes, some that sort of morphed throughout the semester, but some were online throughout the semester. And our hope would be that we can have most of our classes as face-to-face classes. If there is either a statewide or national stay-at-home order, we will obviously comply with that. And one obvious implication would be that instruction would be remote if we have either a statewide or a national stay-at-home order. And it would depend again on the specifics of the order, but we would certainly comply with the order.
Okay, thank you. I'm going to switch gears now, and I'm going to ask Dr. Shelley Gerke in the Provost's office our next question. Shelley, this student is asking, if I don't feel safe and don't want to continue in-person class in the spring semester, but I didn't fall into the criteria this semester to have remote learning, what are my options?
So I think the very first option would be to work with your advisor. Sit down with your academic advisor, look and see if you can adjust your class schedule to have more remote classes. If that's not an option, look to see what hybrid classes are available, and then work with your faculty to make a plan. There are some classes that, are much better outcomes if they're face-to-face, but I think there's some options to explore, especially right here at this point in the ending of the fall semester.
Okay, thank you. I am going to tell our audience, remind you to please ask your questions on the online form. We are quickly running to the end of the list of what we've already got, so if you do have some questions, please submit them. I'm going to send this next question to Provost Cordell. And Provost, I will admit I'm not quite sure the time frame that this question refers to, if it's asking a question about the 2 weeks after Thanksgiving or if it's pointing forward to the spring semester. But the question is, if we don't have evidence that there's transmission of COVID in the classroom and our protocols are working, why can't we open the classrooms and campus back up for our students?
Thank you, Gwen. I would respond this way. We believe very strongly that the adjustments that we have put in place in our classrooms, and I'm talking about reducing the numbers in the room, moving some courses to hybrid or even fully online delivery, We think those adjustments are the reasons that we believe, and it appears that we have pretty safe situation this semester in our classrooms. So looking ahead, whether it's for the remainder of this semester or next semester, regardless of the time frame, as long as there is that need to maintain distance in our teaching spaces, we'll probably need to stick to those protocols in order to keep it safe.
Okay. This next question, which just came in, I am going to send back to Dr. Williams because I know that our health center falls under his domain, so he seems to have a little more information than some of us do. Dr. Williams, the question is, can an individual who has recovered from COVID and has an immunity be excused from the mask policy?
The simple answer to that is no, because there's not any hard evidence that says that there still might not be transition or transmission, and the immunity still has not been defined as once you have it forever. There's a lot of literature actually that says you're immune for about 3 months. And so in a manner of being consistent across the campus and such, the answer simply is no, that everybody would abide by and continue to abide by the mask mandate, the social distancing, and the hygiene.
Okay. All right. Well, gang, that actually brings us to the end of our questions. I'll talk a little slowly in case another one wants to come in. But as we prepare to conclude this Q&A forum, I want to thank everybody who joined us on the call. I think the last count I heard was in the 80s. So we appreciate you joining us and asking your questions and giving us an opportunity to answer them in the larger setting so more people can get the same information. We want everybody to have a great rest of the semester and a safe and healthy holiday season, and are very hopeful that you can get some rest before we come back to campus. Thank you.